So welcome to Jeffrey Literature Online Course Series 1 in 2022. So my name is Lisa from Medical Department from Jeffrey. So today I will share you some very important publications we achieved in the last year. So the purpose of this setting up this course is to help our colleagues and our partners on how to use the medical evidence of our products and help you to more understand how hemoperfusion therapy can be utilized in different indications. So my course will be including 4 parts. First is the 2021 publication review. Second, I will interpret 9 publications on different indications literatures. Third is about the summary of our literature, and the fourth is introduce you the CREATE Project 2022. So at the end of this course, I will also invite my colleague Steven, who is our after-sale manager, will introduce you the new launched website. And he will explain how to use this medical database, and please just make good use of this resource and introduce to our end users if possible. So first, let's take an overview of the publications in the last year. So this is the list of the 25 publications in the past year on different indications from the globe, including China and Kazakhstan and Iran, all different countries. So indications include such as the ESRD, AKI, drug overdose and poisoning, and COVID-19, you can see right here, and also included sepsis, cardiac surgery, vancomycin, absorption, and also included surgical valve replacement, and also include the hepatitis and the liver failure. So with so many applications in hemoperfusion, we will try to expand our indications into other fields, not just like last year focusing on the critical care. So later I will interpret the literatures with the green mark. So besides the published evidence, we also received extensive cases and posters in the last quarter in 2021, which also published on blood purification as an abstract in the last quarter, including the following indications from 10 countries in the globe, including the ESRD, cardiac surgery, COVID-19, and the ticagrelor removal, and septic shock, and so on. So this is the list of the case and the posters with different product models. So I believe our sales team has already sent to you in the last quarter of these posters and the cases. And after this course, I will also share my slides and the course video to you. So second topic is the publication interpretation. So of the solvent HA type cartridges contain, I already see many audience already type A, so this is correct. So next question is about what kind of complications could HA130 therapy relieve? Please type your answers on the screen. Let me see how much you know about HA130. This is a multiple choice. Okay, I see so many people already type A. They are actually the correct answer is all of the above, A, B, C, and D, and E. So Helen is correct, all of the above. The answers is correct. So next, this is I want to share you this meta analysis with 12 studies. Included seven RCTs and 5 cohort studies from 20 2011 to 2020. So these studies all compared HD plus HD versus conventional method with HD treatment on ESRD patients. So this study is aiming to systematically analyze the impact of HD plus HP on the overall survival rate in ESRD. So it results in a very effective absorption in the in removing PTH and B2 myoglobin and other macromolecular with uremic toxins, and also improve the state of microinflammation, reduce the cardiovascular events, thus to improve quality of life in patients. So from this study, what we can know, the study suggests that overall survival rate of ESRD patients treated with HP plus HD were better than those treated with HD hemodialysis. So HD plus HP can achieve a very complementary elimination of metabolites and uremic toxins and the mid-molecular toxins caused by long-term dialysis and prolonging life expectancy. So therefore, HD plus HP could be widely used in ESRD patients. So the second study is also about HA130 on ESRD. So this paper is the retrospective study which involved 144 patients with ESRD. So they divided these patients into 3 groups. The first group is HD groups. They give the patients 3 times a hemodialysis treatment per week. And for the HD or HDF group, they give the patients 2 times hemodialysis treatment and plus 1 time hemodiafiltration treatment per week. For the third group is HD plus 2 times hemodialysis treatment plus 1 time hemodiafiltration and 1 time hemoperfusion treatment in the third group. So from this study, you can see shows the graph right here. The 3 groups in the first month, there's no much difference in the improvement. However, after 24 months, you can see in HD plus hemoperfusion treatment group, there's a significant lower in there's the levels of calcium and phosphorus and the intact parathyroid hormone in hemodialysis plus hemoperfusion group was much lower than those in hemodialysis and hemofiltration group. So from this study, we can know that combination of hemodialysis modes was superior to regular hemodialysis for patients with ESRD in nutritional status and can control the complications which are arised by the long-term maintenance hemodialysis patients, then achieve the life quality and prolonged life expectancy. So what can we learn from these 2 papers on HA130? So for the HA130, we can see they use once a week per 4 hours each in the paper, and it can be used in ESRD patients. So unmet clinical needs include shows that chronic renal failure has become a very major public health concern, and the treatment strategy are urgently needed because filter membrane can only remove few large molecules. However, the hemoperfusion treatment can remove middle to large molecules much better than the filter membrane. So for this, from this aspect, the possible interesting doctors include nephrologists, So what we can achieve from HA130, it can improve the nutritional status and control the long-term complications and improve the life quality to thus to improve the survival rate. So HA130 can remove phosphorus and IPTH and beta-2 myoglobin and some protein-bound uremic toxins. So for the partners, what you need to know about this commercial opportunities to promote this product is that to improve efficacy of this therapy, it has very good biocompatibility and it's very easy to use, good compatibility with most machines and with economical efficiency. So the next warm-up question is an open question related to HA230 hemoperfusion cartridges. Do you guys know what toxins, what poisonings or drugs can be removed by HA230? You can feel free to type in the box. Let me see how many drugs you know that HA230 can remove. Please type your answer in the chat box. Let me know. Okay, most of the people already typed the poisons that we can HA230 can absorb. You are all right, but not all drugs because it depends on the drug's molecular weight. So it cannot absorb all the overdose drugs. It depends on the affinity and the molecular weight. So let me share you some drugs that HA230 can remove. And I will explain one important paper about the methotrexate drug overdose in a publication. So HA230 can absorb paraquat such as ASOP and snake bite and venom mushroom poisoning, ticagrelor and digoxin. So next I will show you the methotrexate drug overdose. So this paper is actually a new case from Kazakhstan in the last year. So for this case, the report methotrexate is a drug that often used in cancer patients or who have hematological disease such as acute lymphocytic leukemia. In this case, it reported an 8-year-old child that diagnosed with acute lymphocytic leukemia and who needs this medication. However, with this medication side effects, so they use HA230 absorber to absorb the methotrexate. So from this graph, you can see the methotrexate after 6 hours, the decrease rate is about 85.27% of drugs already removed by the HA230 plus CVVH treatment. So this paper indicated that management of methotrexate toxicity using the HA230 absorber in case of delayed methotrexate clearance during the single 4 hours procedure and well tolerated in the patients with acute lymphocytic leukemia. So what we can learn from HA230? HA230, we recommend you use 4 hours each cartridge for 3 consecutive days. The indication is drug overdose and poisoning because there is no right antidote for the overdose drugs and poisoning. So with this aspect, HA230 can be used to remove overdose drugs with conventional treatment fast to improve the survival rate. So the possible interesting doctors will be the ICU doctors and the pediatric doctors. So what we can benefit from, what's the benefit from HA230? It can clear the overdose drug and lower the drug's concentration to improve the hematologic parameters. So the biomarkers will be the drug's concentration. So in the last paper is the methotrexate concentration they measure before and after. So you will see the how much the concentration is decreased. So for this, for the partners, what you need to know is about the commercial opportunities. So this is a new case and from Kazakhstan, and it's a new indication. It will refresh doctors' knowledge of hemoperfusion technology. So next, another question came. Please also type your answers on the screen. So which indications can HA330 and HA380 be applied in? Please feel free to type in the box. All right, most of you already got the right answers. So HA380 and HA330 can remove all the can be applied in all the indications such as sepsis, septic shock, COVID-19, and severe acute pancreatitis, and cardiopulmonary bypass surgery, and the subarachnoid hemorrhage and the ARDS. Next, I would like to share you a case about the application in subarachnoid hemorrhage. So this is a paper that was published in last year from Iran. Iran actually has a lot of experience in COVID-19 patients, but this paper is aiming to measure the mortality rate after using compare HD and compare HP plus CVVH and with intervention with conventional treatment. So this is early start of hemoperfusion decreases the mortality rate because the PF ratio is less than 200. Those 68 patients were enrolled with not very severe critical symptoms. So this in this paper, it shows the interventional group who are using the hemoperfusion therapy compared with the control group. After the treatment, the mortality rate is significantly decreased in the interventional group. You can see the 37% versus 63%. So interventional group showed a significant mortality rate reduction compared with the control group. This positive effect was stronger among the patients with a PF ratio who are higher than the 75. It means you have to start as early as possible in the COVID-19 patients. It will reach a better significant mortality rate reduction. So from this study, the result implied the early start of hemoperfusion could be more effective, and significantly reduced mortality rate among the COVID-19 patients with critical disease. So what we can learn from this case? This is a case that using HA3380, and they use in 3 consecutive days with 4 hours each cartridge. They use on the COVID-19 patients. Why they use on COVID-19 patients? Because there is excessive cytokine release that cannot be controlled by the conventional treatments, just like a drug medication, like other basic treatments. So the possible interesting doctors include the infectious unit and the ICU department. If you use HA3830, it can improve the oxygenation and lower the mortality rate. So the biomarkers will be to measure the cytokine level and see how much improvement on PF ratio. So from this paper, from this aspect, our partners should remember the commercial opportunities for HA330 is you can share with the doctors about this case because it's a new case from Iran, and the doctors have have a lot of experience in hemoperfusion technology on COVID-19 patients. So also we can try to imagine it can be related to the other cytokine release related disease instead of COVID only. So next is about another paper about the septic shock from the Turkey. It's a new indication because the septic shock can lead to some other disease such as DIC and SPG, symmetrical peripheral gangrene. You can see the picture right here. This is a patient who has the SPG after he got the septic shock. It has bilateral distal extremities problem. So after giving him the 3 HA330 absorbers, used over 3 days, each cartridge will be used only 2.5 hours. You can see the graph here. After hemoperfusion treatment, the CRP and the PRC level and the lactate level is increasing down. So there's a significant improvement of this cytokine concentration. Also, by the 3rd day of HA treatment, the vasopressor use was discontinued, and SPG in both feet, you can see right here, it recovered almost to the normal field. So from this study, we can know early management of septic shock with administration of HA treatment within 24 hours might have prevented the amputation from being required. So what we can learn from this case on HA30, it can be used over 3 consecutive days with more than 2.5 hours. It can be used on symmetrical peripheral gangrene induced by the septic shock. because there is excessive cytokine release that sepsis can develop into DIC and the SPG. So the conventional treatment cannot control the cytokine storm. So the possible interesting doctors will be the ICU unit doctors. So it's and after use the HA330 on these patients, we can stop the vasopressor uses and decrease the cytokine levels and elevate the symptom associated with DIC. So the biomarkers to be tested in this patients will be the cytokine levels, procalcitonin, creative CRP level, and D-dimer and lactate. So what you should remember is that this is a very good adjunct option, avoiding the destructive effects of the cytokine storm and DIC. So this is also a new case from Turkey. I believe this case will inspire more insights, more aspects, more perspective for you to encourage the doctors to use in another indication. So next literature is another new indication from Chile about the subarachnoid hemorrhage by using HA380. So this case presented a 57-year-old man with subarachnoid hemorrhage of the right posterior communicating artery. So after giving this patient's 12-hour session of hemoperfusion with high volume hemofiltration, in the second and the third day, only 8-hour HVHF was performed. So it means the hemoperfusion treatment only used on the first day with 12 hours. So you can see from this this graph on the day when the patient was given the HA380 treatment, you can see there is a decrease down. There is a lot of decrease about the vasopressor use. And after on the sixth day, you can see there's a decrease about the cytokine release. So the C-creative protein and the procalcitonin decreased down after the 6 days. So on the post-operative day, 39 days, the patient got discharged from the hospital without any neurological sequelae. So from this case, we can know the rationale of hemoperfusion on this kind of disease, which is on subarachnoid hemorrhage. It shows a correlation between the levels of cytokines and their outcomes. An early elevation of the cytokine is associated with the neurological deterioration and develop of delayed cerebral ischemia. So what we can learn from this case? This case showed the HA380 can be used on about 12 hours each. It can be used in the neurocritical care disease, such as the subarachnoid hemorrhage. So from this aspect, it means the hyperinflammatory phenotype which caused by this kind of disease can lead to a significant circulative impairment with a multi-organ failure and even death. So the possible interesting doctors will be include the neurocritical care doctors. We can see in this case, HA380 can decrease the vasopressor use and maintain the adequate cerebral perfusion parameters. So you can measure the cytokine levels such as CRP, procalcitonin, interleukin-6, lactate as a biomarkers to see the effectiveness of HA380. So you need to know the commercial opportunity for the cartridge is this is the new indication that was published in Chile you can share with the doctors about this new indication uses to refresh the doctor's knowledge of hemoperfusion technology in other indications. So it deserves a lot of try in the new indication, and more discoveries needed to be done. So the seventh article is about the cardio pulmonary bypass. This application is used. This HA380 is used in cardiac surgery. So this 60 patients will underwent the surgical valve replacement in this study, and they divided the patients into two groups. First is the hemoperfusion plus CPB group. The second one is the control group, which is only use the CPB treatment. So for the HP plus CPB group, they give the treatment with the HA380 plus CPB circuit over 2 hours. And the control group, they just give the CPB circuit about 2 hours. So you can see from this picture, you can see the cytokine levels between the control group and the hemoperfusion group. There's a significant decrease in the HP group. The orange line you can see is lower than the blue line. So the HP group has significant lower levels of the interleukin 6 and 8 and 10. Also, it has a significantly lower levels of hepatic toxins compared to the control group. And also it had significantly less vasopressor uses and shortened the mechanical ventilation and ICU stay. So from this study, we can know that HA380 cartridge can effectively reduce the systematic inflammatory mediators and improve the post-operative recovery of the patients during the CPB treatment. So what we can learn from this case, this study, the study is a new indication in cardiac surgery. All the patients combine the surgical valve replacements and use the CPB time is over than 2 hours. Because why we want to use the HA380 in the CPB circuit? Because during the CPB circuit, there will be a lot of cytokine release during the treatment. So if you insert HA380 inside the CPB treatment, it can decrease the vasopressor needs and reduce the inflammatory mediators. So from this aspect, you will know the commercial opportunities for HA380 is to enrich the therapeutic strategy, easy to connect with the CPB and ECMO. So next is another one part about the DPMAS. What kind of illness could DPMAS use for? Could you please type your answers in the chat box? Let me see. All right, thank you all. All of you are correct. Yes, it's all the disease can all above the disease can be used for DPMAS, like jaundice, liver failure, and hepatic encephalopathy, and the drug-induced liver injury. So next, I will also illustrate a case about the DPMAS. So this is a case from China. It's about the acute and chronic liver failure. So because artificial liver support system has been demonstrated to be safe and well tolerated as a bridging therapy prior to liver transplantation. However, it remains unclear as to whether the artificial liver support system treatment before the liver transplantation has an impact on the survival rates. So this study is aiming to determine the impact of the artificial liver system treatment on the surgery and outcomes after liver failure. So they chose the 166 patients that were enrolled in this retrospective study. They give the patients, they divide the patients into two groups. First group, they give the artificial liver support system plus the standardized medical treatment, and also including the liver transplantation afterwards. So you can see the 77 patients, they do the plasma exchange, and 157 people, they do the plasma diafiltration, hemodiafiltration, and 88 patients, they do plasma exchange with the DPMAS treatment. And for the control group, they just have 57 patients who received the emergency liver transplantation after the standardized medical treatment. So from this graph, you can see the yellow one is the interventional group, and the blue one is the control group. You can see the artificial liver support system treatment is can achieve a higher survival rate compared with the control group. In the first 4 week, first 4 weeks, and also in the 12-week survival rate. You can also see there is also a decreasing down in the artificial liver support system treatment group. So from this, after the liver support system treatment, the conditions in each group improved. The biochemical parameters such as ALT, AST, and creatinine and other indications was significantly lower than in each subgroup. And the mild and score after the treatment was significantly lower as well. Patients in the artificial liver support system group also had a significantly lower, longer waiting times for the liver donation. So blood loss during the surgery and ICU times after surgery were both significantly lower. And the 4 and 12-week survival rate in the observational group was significantly higher than those of the control group. So from this paper, we can know that DPMAS can be used in acute unchronic liver failure, because we know liver transplantation is the last step for the liver failure patients. But since there is a lack of donor livers, and also it's very expensive for the patients, so DPMAS is a good choice for the liver failure patients. So this can be used in hematology department and in infectious departments who has liver failure. From DPMAS, the patients will benefit in improving the survival rate, shorten the ICU stay, and it's also a bridge to the liver transplantation. If you use DPMAS, you can try to measure the biomarkers such as bilirubin, bile acid, and hepatic toxins, and some other cytokines levels. So from these aspects, you will know the commercial opportunities for this for DPMAS is to enrich the therapeutic strategy in liver failure patients. We don't just have the liver transplantation. You don't have to wait a longer time for the donation. You can use the DPMAS as a bridge to the before the liver transplantation and also after the liver transplantation. Okay, this is the last question. So please type your answers in the box. Could HA cartridges absorb the ticagrelor? Let me know your answers. I know ticagrelor is a very interesting topic for everyone, and every doctor would like to know HA cartridges, can they absorb the ticagrelor? It's an antiplatelet anticoagulant. Yeah, Sammy said technically yes. Yeah, the answer is yes. Let me see. Let me share you why HA cartridge can absorb the ticagrelor technically, because yet to date now we don't have any publication about the ticagrelor absorption, but technically yes, it can absorb ticagrelor. So here I want to share you a abstract about the ticagrelor removal by HA330, which was published in which we changed our course in last year, October, on the blood purification abstract. So you can see this is a ticagrelor removal by hemoabsorption from human blood. So this is the laboratory test from Jeffrey about the removal rate of ticagrelor. You can see ticagrelor is an antiplatelet anticoagulant commonly used before elective coronary artery bypass graft surgery. But if the patient has to be given the emergent surgery, so that requires to remove this antiplatelet coagulant very quickly to prevent the bleeding complications during the surgery. That's why we need the absorbent to remove this kind of drug. So from this test result, you can see after the 7 hours, you can see the HA330 can absorb 80% of ticagrelor from the human blood. It means that HA330 has a very good removal performance for ticagrelor. So there's a hypothesis about the HA330 has the clinical application potential of applying low dose ticagrelor during the cardiac surgery and reduce the risk of bleeding. So that's why today why I want to share you about this test result, because I want you guys to know that ticagrelor as a very important antiplatelet coagulant during the cardiac surgery, it is often used by the cardiac surgery doctors. So you can recommend this treatment for in cardiac surgery, and we can collect more evidence in the real patients, and hopefully we wish that there will be a lot of clinical studies will be undergoing, and we will have the publications in the following months. So what can we learn from this paper? HA330 can be used in the ticagrelor removal in cardiac surgery, because the bleeding complications will be occurred if you don't remove the overdose ticagrelor in the cardiac surgery, because there's a lack of the treatment to remove this kind of drugs immediately. That's why we need the hemoperfusion treatment during the cardiac surgery. From this paper, you will know the HA330 has a very good performance for removal performance for ticagrelor, and it will be a new indication and has a lot of potential in the cardiac surgery. So summary. So in summary, HA products can be utilized in different diseases with different models. For critical disease, we recommend you to use in the hyperinflammation disease to reduce vasopressor use needs and improve the oxygenation and improve the survival rate. For the HA130, we recommend you use in ESRD to reduce the middle molecular toxins and the protein-bound uremic toxins to relieve complications of long-term hemodialysis and improve the quality of life and the survival rate. For liver failure, we recommend you use the bilirubin absorption and DPMAS to reduce the bilirubin and bile acid in the liver disease and reduce the hepatic toxins as a bridge to the liver transplantation. For HA230, you can use in the drug overdose and the poisoning to reduce the drug concentration and to improve the survival rate. So hemoperfusion technology is a very safe technique without obvious side effects. And it's very easy to perform on different platforms such as the ECMO, CRT, and hemodialysis. It also could be used in children and adults. So there are a lot of new indications and the large-scale studies are going on and become more and more available. So we can achieve a lot of evidence in the future. So the last part, I will use one slide to introduce you about the CREATE-8 project in this new year. So we really welcome you to encourage the doctors to submit and share their experience during this new year. So for this year, the creative plan we will have some revisal about this project. We aim to concentrate on the case series and the randomized control study and the protocols and ICI papers this year. We hopefully to collect 40 high evidence based medicine evidence, and each CREATE manuscript will be directly uploaded to JEFRON case section. Here, Stephen will explain about how to use the medical website. And for the training, we will give you all the people about every half year. We will update you the literature we already collected and which published. So please try to encourage the doctors because we have a very big. We might have big rewards for the case collection, and maybe there are some lottery incentives for the doctors to submit the articles and share the experience. So we wish every doctor could contribute to the academic phase in the blood purification field. We try to figure out when to initiate hemoperfusion and how long we should use our cartridge. So so from this aspect, we need your support, and we hope that we can achieve more achievement in the future. So this is my presentation, and thank you all for listening. And next, I would like to invite our colleague Stephen to share you the new launched website, and also he will explain how to use the website.
Okay, thank you, Lisa. Thank you. Please mute your voice. Thank you. Okay, hello everyone. This is Stephen Wei. I'm an in-market supervisor from JEFRON. I'm so glad to give you a brief introduction of our new JEFRON website. Let me share my screen. Can you see my screen? Yes? Okay. So let's begin. I'm so glad to be here and give you a launching and introduction of our JEFRON website beta version. And let's firstly see the site overview and look briefly about what is the difference between the new version and the previous version of JEFRON website. We can see that in this new version, we have several parts: about us, therapies, medical center, media and events, contact, products, and for investors and our partnership part. And our URL website address will be 3w.jeffroninternational.com. Okay, so let's see what's the different functions between the previous one and the new one. We have the 4 core functions for our new English website. Here we can see we have a medical center section, we have a customer service, we have a partner VIP section, and official website plus Jeffron Club. So this is the beta version for us, and our completed version website will be launched in March 2022. And we can see the upgrade of Jeffron new website aims to create an official online interactive platform with rich functions and easy operations, and providing clinicians and partners with a more user-friendly experience. And we can see it has optimized the web design and functions, and we add some good features like you see here. And next, let's move on to the medical center part. In this part, it is specially designed for our clinical doctors, and it includes 5 functions. We can see the first one is literature database, which contains 1,050 plus published articles, and each with a detailed content text, so you can look for the articles you want very easily. The second one is the researchers part. In this part, we will give you all-round display of the global. We can show you the comprehensive and detailed therapy application videos from the clinical side, from the professor of Jeffron, and you will get the help communication part. We can submit the new cases through the this function, and just like our create project last year, right? And the next partnership, which is another special part in our new version official website, we can see here in this part, we have established a very efficient and well-considered exclusive section for our partners, actually. And each of the partner of Jeffron can register as an exclusive account. And you can watch all kinds of product training videos at any time and anywhere. And next is the marketing training education tools. In this part, you can download the tools for marketing education very easily, conveniently, and there's no need for as early we send you by email, or you just can download them from the JF Drive. So we have another good function here. And the third one is the Jeffron Monthly. We put the Jeffron Monthly part in our partnership because we want to deliver the recording of our steps. We want to make you to keep abreast of the new summary of Jeffron news. And the next is the literature database. As I mentioned before, in the medical center part, here we give you the literature database link here to make you easier to search the articles you want, and you don't need to go back to medical center to find this function. Okay, the next one is the customer service. We can see here we have several new functions here. First one is the 24-hour customer service hotline, which means anytime if the customer want help from us, they can give us the phone call, and we will have the professional colleague to answer and give the help. Second one is the contact form. We not only can connect our customer by telephone, we can also contact them by the message. And the third one is the clinical and non-clinical customer feedback. Because from now on, we will pay more and more attention to our after-sales experience. We want to give our customer a better experience after they using our cartridge, our product. So here we set up clinical and non-clinical customer feedback forms to get information from the front side of our market. And our professional team will provide sincere help as they need. In the end, I want to send you a very sincere invitation that to join as the first users of our Jeffrong English website and give us your experience and suggestions of using this one. And after this meeting, I will send you 3 materials like the exclusive invitation code and user manual, instruction videos. And I think that will help you to understand what is the difference between the previous one and the new version of Jeffrong website. And if you have any question, you can ask me to deliver me email, and my email address is here on the screen. And next, I think I can I can share you my screen and give you a brief instruction or demonstration of using our new website. Okay, I think maybe some of you has already input the URL and searched our website already. So let's do the brief introduction. How can we register as a VIP account of Jeffrong website? Let's see on the screen, we can see here is the register button here. If we press here, we can see there is a form. So after you filling this form and press the submit button, then we can get the application message, and then we'll give you a approach to become the VIP of Jeffrong website. And when you have become VIP of Jeffrong website, then you can log in with your account and password here. And now let's do my login here. I enter my email address and my password and the variation word here. Then we can log in. If you notice that after we log in the website, the previous one business has become to partnership. So this part will be the very important one. We will connect with you and share some materials and tools with you. Let's move to this part, partnership. What can you do in this part? We can see here, there are several functions. First one is the training videos. Here, if you press learn more here, you can see all our training videos has been divided into 3 parts: products, operation, clinical education, and every of them, the category has several categories like HA series, BS series here. Let's go back to the page of partnership. And the second one is marketing, training, education tools. In this part, you can see we also get some materials like brochures here. If you want to download them, you can press the icon here, the download icon, and you will get the materials you want. And the next one is the Jeffrong Monthly. Here we put some our Jeffrong Monthly we have sent you before. And in the future, you can review them at any time, anywhere, if you want to know what happened and what's happening in Jeffrong. And the fourth one is the literature part. And next, I want to introduce you the medical center part. You can find medical center part in many places, like on the home page, we can see here. You can see the area of medical center. If we press learn more here, then we will enter it. In this part, we have 4 functions here you can see. First one is the literature, which is the most important one, and you paid more attention, very huge attention on, right? And you want to know how to find your literature, you want your articles from the website. So here is the one. We can see that we arrange our articles, our publications with a very smart structure here. There are several texts on the left hand, if you can see. We have several categories like department, model, target substance, benefits, year, and so on. So what can you choose the publications you want? Like if you want the emergency one, and you can see the articles has changed and it shows what you want. And also you can enter the keywords, author, year, anything you want, and then you will get the targeted or the desired articles you want. And next one is the searches, researches. In this part, you can see that we listed our undergoing researches on the list. And you can press here and go to the clinical trials document and to find the source here. Next one is the therapy application. It is also the training videos part, but because it's a beta version, so we have several materials need to be uploaded in the future, very near future. I think we will complete it with you, with our colleague very soon. And the fourth part is the submission of new cases. In this part, you can see there's a form as the previous English website. You can enter your details or ask our doctors to enter it and upload your file, your new cases, and send to us. If our team get the information from the clinical side, we will respond very soon and with very professional help. Okay, and I think that will be some new functions of our website. Oh, there's another one, is the customer service. Okay, let me introduce the customer service here. For customer service, we have several changes here. Also, you can see, you can find on the navigation bar on the top of the website, there is a contact button. If you press it, you will go into the contact us part. And in this part, you can see we have some details of the telephone, the email address, and also the contact form. Here is the careers one. And the customer service, here you can upload or send your request from the non-clinical or clinical form to give your feedback when you use our products, and we will help you if you need any time. Okay, I think I have done the introduction, brief introduction of our new English website. Okay, there's some question. Let me see. Okay, invitation code, right? How can I get invitation code? I already know. Okay, that's a good question. We will give you every employee of our partners one use invitation code. And after this meeting, because we need to calculate how many customers, employees need our invitation code, and we will send you maybe through our sales colleagues, or I just send you directly. So after the meeting, I will give you the invitation code, then you can register very easily. And also, I will send send the invitation code with the manual one and the instruction videos, 3 parts, 3 materials I will send to you and make you easy to register as a VIP of our English website. Am I clearly answered this question? You mean to, sorry? What's your... Oh, so, okay. So I can send the slides today for the launching meeting to you, and please feel free to ask help if you want any help. You can ask me through the email. I will type my email address here. Okay, and if you have any questions when you register as the VIP, please let me know, and I will provide help. Yeah, and Lisa also will send you her slides to make it clear. Any question? Let me see. How can I get education? Is ready right now. Oh, it takes time. Sorry, I think there is no more questions in the chat box. So, okay, so this meeting is end. This